A 35-year-old man presents with headaches, loss of libido, and erectile dysfunction for the last 3 months. The physical exam is notable for peripheral vision loss, bilateral gynecomastia, and soft testes without masses. Lab evaluation shows normal serum prolactin, normal beta-HCG, low serum LH, and low serum testosterone. Which of the following is the most likely mechanism for this patient's gynecomastia? Now, this patient is presenting with symptoms of a pituitary mass, and we know that from the headaches and the bitemporal hymenopsia that the person is experiencing. So remember that a pituitary mass can compress the optic chiasm, resulting in peripheral vision loss. So this person also has a low serum LH, and so he has a secondary hypogonadism. Remember that in primary hypogonadism, we're going to have something wrong with the testes or the ovaries, resulting in a decrease in sex hormone production. But in secondary hypogonadism, we have something wrong with the hypothalamus or the pituitary, which results in a decrease in the production of hormones that actually stimulate the ovaries or the testes to produce sex hormones. So, because the LH levels are low, we know that this is a case of a secondary hypogonadism, which is common in pituitary adenomas. Pituitary adenomas can cause secondary hypogonadism due to an increase in production of prolactin, which has a negative feedback on the hypothalamus. So we would have a decrease in GnRH production, resulting in a decrease in FSH and LH. And remember that LH actually stimulates the testes to produce testosterone. So as a result, this can cause secondary hypogonadism. Now, this patient actually has normal levels of prolactin, so he most likely does not have a prolactinoma. So what is causing his gynecomastia if he has normal prolactin levels? Well, due to a mass effect, we can actually have destruction of gonadotroph cells in the anterior pituitary, which produce LH. So due to the destruction of those cells, we would have a decrease in LH, and so that would result in a decrease in testosterone levels in the body. And so this can lead to gynecomastia because anything that disrupts the estrogen to testosterone ratio can lead to gynecomastia. So remember that if the estrogen to testosterone ratio is increased, that can lead to gynecomastia. And so this person has low testosterone levels, and so if they have low testosterone levels, then the estrogen to testosterone ratio would increase, and this can lead to gynecomastia. Now, the zona reticularis in the adrenal cortex produces estrogen precursors like dihydroepiandrosterone and androstenedione, and these precursors can be converted into estrogen in the periphery with the enzyme aromatase. And in the absence of testosterone, this can actually promote gynecomastia. So this is what is most likely happening in this person. There's going to be persistent amortization of adrenal estrogen precursors, and this can lead to gynecomastia in the absence of testosterone. So the answer is going to be answer choice E.